So for bones, BYOB. Do you know what is BYOB? A party related topic. Do you know? BYOB? Yeah. And for the dissection part, the common things will be asked. Okay, and that thing will make you pass only. Okay. Any questions relating to anatomy? Any questions? No questions. Konkona bhumik. Stand up. What are the muscle of back of forearm? How many muscles are there? What is the nerve? Do you have any plan? Like this is how you will study and all. Who can tell me what are the muscles of back of forearm?
Sir, like the back of the forearm, we have two bones, the radius and radius. We have the extensor carpi radialis, extensor carpi alnaris, extensor pollicis longus, extensor ignitis, extensor residuum, extensor digiti minimi, the abductor pollicis longus, and supine intermuscle.
Okay, when you answer now, go in a organized manner. Okay, first go in a organized manner. First tell them about the superficial and deep. Okay, there are some superficial muscles, there are some deep muscles. Show me, what is that? Key related. There are superficial muscles from lateral to medial, you tell them. Okay, because you need to remember like that only, from lateral to medial, or go medial to lateral, but in an organized way. Okay, yeah, I'll tell you. Okay, what is the largest bone and the smallest? Where is the stapes? So go the Vinci on this. Draw this. Everyone draw this. Don't label, just draw the diagram. Okay, so take this C and pass it to the next person to you. So, do you guys want notes?
Yes.
Then I will tell you. Okay, like every other bone, this is femur. Okay, write down. It has three parts: upper end, mid shaft, and lower end. Middle part is shaft. This is the shaft body and the lower end. So we will describe the upper end. So in the upper end, you can label or you can write. There is this head. Okay, a globular head. First thing. Then on the head, this is a ceramic. Okay. There is supposed to be a groove here. Okay, pit. This is called fovea, which you can see here, but it is not on this artificial bone. Okay, this is about the head, nothing else. Then comes the neck. This is the neck. If in the exam they ask you what is neck, you tell them this is the part which attaches or joins the head to the shaft. Okay, so this is the neck. It has two borders. One is the upper border, one is the lower border. Two borders of neck, upper and lower. So how many surfaces will this have? If it has two borders, how many surfaces will be there? Borders. Okay, this one upper, this one lower, here to here. This is which surface? Anterior. From upper to lower, what is? So it is two surface, anterior and posterior surface. Then on the lateral aspect, there is this thing. It is called greater trochanter. This part is greater trochanter. Now about greater trochanter, it has one border, this one only, the upper border. only one border, upper border, and three surfaces. One is anterior surface, one is lateral surface, one is medial surface. Greater trochanter having one border, upper border, three surfaces, anterior, lateral, medial. On the medial surface, you cannot see from the back. There is a groove here. This is the posterior aspect. There is a groove here. Okay, that's a bony depression. Okay, this is trochanteric fossa. On the medial surface of greater trochanter, there is a fossa. That is trochanteric fossa. Then on the medial aspect, there is this one. This is lesser trochanter. This is greater. This is lesser. This is lesser trochanter. So anteriorly, this greater and lesser trochanter, there is a line between them, intertrochanteric line. As you can see, this one, this is the intertrochanteric line joining the greater and lesser trochanter. Intertrochanteric line. Know all the parts because muscle attachments you will be telling me. Okay, I will not tell you the muscle attachments. Okay, this intertrochanteric line. What is this aspect? Lateral or medial? Okay. This intertrochanteric line goes to the medial side, comes out in the medial side on the posterior aspect and continues as the spiral line. This is the spiral line. So in the posterior aspect also, this is the greater trochanter, this is lesser trochanter. There is a thing that is joining the greater and lesser trochanter, but it is a prominent part of bone. Okay, this is intertrochanteric crest. This part is elevated. Okay, this is intertrochanteric crest. On the intertrochanteric crest, there is a tubercle, another bony part, bony prominent part. This is quadrate tubercle here. Quadrate tubercle is located this one. This is the quadrate tubercle. This is about the upper end. Okay. Now about the shaft. Shaft has got three borders: medial, lateral, and posterior. Three borders: medial, lateral, and posterior. So what will be the surfaces? If it has medial, lateral, and posterior border, what will be the surfaces? How many surfaces will this have? So there are three surfaces: anterior, medial, lateral. This is the intertrochanteric line. From here, continuing on the back as the spiral line. Okay. Then there is this, write down, this is the gluteal tuberosity on the upper aspect. Gluteal tuberosity is not present here. You cannot see on this. From gluteal tuberosity also, there is a line coming down and joins on the middle part. This whole part is the posterior border only, but it has a name. This is linea aspera. The posterior border of femur is called linea aspera. This part is linea aspera. Okay. Two lines joining to form linea aspera, and it has got two lips. This is the medial lip, this is the lateral lip. Okay, medial and lateral lip of linea aspera of the posterior border. So here two lines are converging to make the posterior border. Then again it diverges. Okay, these are the condyles. Okay, so these are supracondylar line. One is medial supracondylar line, one is lateral supracondylar line. This is about the shaft. Then on the lower end, it has got two condyles. These are the condyles. This one and this one. Okay, this one and this one. One is medial, one is lateral condyle. And there is a bony prominent part here, slightly above the condyles. Okay, these are the medial epicondyle and lateral epicondyle. This is the lateral epicondyle. These are the condyles. This is lateral epicondyle. This is the medial condyle. This is the medial epicondyle. Epi is up, above. Okay. There is medial epicondyle and lateral epicondyle. And there is another bony prominent part. This is adductor tubercle. It is above the medial epicondyle. Okay. On the medial border, medial aspect. Okay. On the medial aspect, above the medial epicondyle, there is a bony prominence called adductor tubercle. These are about the parts. Nitin. Okay. Give him the femur. Take the femur. Describe the upper end.
Fovea. Also neck. Or lesser trochanter. Also anterior surface. Greater trochanter.
What are the borders of neck? How many borders does the neck have? Two borders. Where are those? What are those? Show me the borders. Upper and lower border. Show me upper and lower border. Where is the neck? Which part is the neck? Okay. Then where is the upper border? Lower border. Okay. Isha Dubey. Pass it to her. Describe the upper end.
So this is head, and this is neck, upper end, lower end.
Borders.
Upper border, lower border.
What are the surfaces? This is the upper border. This is the lower border. So there is a surface. No. So what is this surface? What is the surface between upper and lower? Anteriorly and posteriorly. Okay. Where is the greater trochanter? Okay. What are the borders and surfaces of greater trochanter?
Interior.
Show me the anterior part. Suppose, hold it like that. Okay, show me the anterior part of, you are holding anteriorly, okay? I mean, this is the anterior part, okay? You are seeing the posterior part. Okay, so where will be the anterior surface of greater trochanter? You are seeing the bone from posterior aspect, okay? This is the bone, okay? I am seeing this on the posterior aspect, okay? So where will be the anterior and? No. And what are the surfaces of greater trochanter? How many surfaces? What are those?
Anterior, posterior.
Anterior, lateral and medial. Sit down. Scythe. Kindly stand up. Shaft. Tell me about the shaft. Where is the head? Tell me about the shaft. How many borders?
3.
Can you show me those? First, second, third. Tell me the parts. Where is the lateral? Where is the medial? Where is the posterior? What is the name of the posterior border? Okay, remember her. Okay. Likupu. Who is Likupu? Tell me about the lower end. Lower end. Describe the lower end. Lateral epicondyle. And what else? Beto, sit down. Ananya Thakur, describe the lower end. Where is the condyle and where is the epicondyle? Epi, dermis. What is dermis? Skin. Where do you think is the epidermis? Below the dermis or on the upper part of the dermis? AP is up, okay. So if this is the condyle, if this is the condyle, it will be in the upper aspect, okay. This is the medial condyle, this is medial epicondyle, okay. So where is the lateral condyle? Lateral epicondyle. Okay, better. So now there are 21 muscles. 21 muscles. Debulina. Who is Debulina? You. How is your health now? Good. You will tell me, okay? Everyone will tell me. 21. If I show you this muscle, this is the gluteus minimus muscle. Okay? So where do you think is this attached? Greater? Lesser. Lesser trochanter. No, doesn't. You don't need to be sorry. It is your first class. Okay, so this is which trochanter? Then, if you can be more specific, if you can be anterior aspect. If it is surface, then say surface, okay? Anterior surface. So write down gluteus minimus is attached. Gluteus minimus is attached on the anterior surface of greater trochanter. Samipsing. Stand up. This is a muscle, piriformis. All these name, these will be alien to you, okay? Because when you were taught about the bones of upper limb, clavicle and scapula, then the subscapularis, brachialis, all those things are alien to you, okay? So, but I hope now at least you know where to see those muscles in the dissection hall, okay? So like that only, this muscles, name of these muscles will be alien to you, but you will see when we dissect the lower limb, okay? So, this is a muscle, piriformis. Tell me, where is this attached? In respect to femur, what is this part?
This is
Greater trochanter, and if you can be more specific, which part of greater trochanter?
the upper border.
Upper border. So write down piriformis is attached on the upper border of greater trochanter. Tia Sarkar, how do you think this is attached? This is psoas major. Lesser trochanter. If this is anterior aspect, this is the posterior. So this is posterior aspect, this is anterior aspect, okay? So if you are seeing from anteriorly, what will you say? Where is this attached psoas major? On the
upper end.
No. In respect of lesser trochanter only. Which aspect?
Medial aspect.
You are seeing, if you are seeing this from the anterior, this is 2D image, okay? If you are seeing this from the anterior aspect, if you can see this, okay? If this was medial, it should have been here, okay? This is, if you are seeing this from the anterior aspect, then you say on the anterior aspect only, okay? Sit down. Psoas major is attached on the anterior aspect of lesser trochanter. Konkona bhumik. This is a 2D image, okay? So here they cannot show you the lateral surface, okay? Does the shaft has lateral surface? How many surface does the shaft have? And? Okay. So this is a muscle, vastus intermedius. Make a guess, where is this attached? It is present there also, okay? This pink one, no? Shaded pink, okay? This is the vastus intermedius here. This one and this one, okay? The most lateral. Okay, tell me. Anterior? Anterior? Anterior. And any comment about this part? This part? If this is a 2D image, and any guess about this part? Okay, sit down. Write down. Vastus intermedius is attached. If you divide the shaft in 4 parts, this is the upper 3/4. Okay, this is the upper 3/4 part. So vastus intermedius is attached on the upper 3/4 of the shaft in anterolateral aspect, anterolateral surface. Upper 3/4 of the shaft on the anterolateral surface. Beacon. Okay, this is a linear muscle. Okay, what is this line from here to here?
Intertrochanter line.
The trochanteric line. Okay, from here to here. Okay, so this is a muscle starting from here, going down to this. This is the lateral or medial side. This one.
This is lateral side.
Okay, it is coming here on the lateral side. The red one up till this. Okay, so make a guess, where is this attached? Start from the anterior part. So start from here. What is this line?
Intertrochanter.
So it starts from
Lateral.
it starts from startable. Tell me the starting point. Intertrochanteric line. Then this is, what is this part? Greater trochanter. So it is below the greater trochanter, right? So on the, what is this tubercle? Tuberosity. Okay. So it is on the medial aspect of medial. Again medial. On the lateral aspect of. Then comes. Okay. Tell me which lip is this? Lateral or medial lip?
Medial lip, sir.
This is medial lip.
Right, sir. Lateral, sir.
Okay.
Lateral.
Okay. Sit down. Write down. Vastus lateralis takes a linear origin starting from the upper end of intertrochanteric line, then on the anterior aspect and below the greater trochanter. Anterior aspect and below the greater trochanter. What should I repeat? Vastus lateralis takes a linear origin. It's a linear muscle, okay? Long course. It takes a linear origin starting from the upper end. This is the upper end, okay? If this is the intertrochanteric line, this is the upper end, okay? This is the lower end. So it takes origin from the upper end of intertrochanteric line, then on the anterior aspect and below the greater trochanter, then posteriorly on the lateral side of gluteal tuberosity. Lateral side of gluteal tuberosity, then on the lateral lip of linea aspera. 4 words, 4 things you need to say. Then lateral to the gluteal tuberosity, then on the lateral lip of linea aspera. Oshit Roth, tell me. This is vastus medialis, okay? This one, okay? It starts from here, comes down, this one, okay? The brown one. Starting from here, goes to this, up to this part. Here is the vastus medialis attached. Start from the upper part. Which part is, what is this line? This is, if this is the upper end, this is the lower end, okay? Then what is this line? Then if it comes down, this is the which lip? Which lip? Lateral. medial lip. Then what is this line? And this one? Adductor. Tell me. So it starts from upper end or lower end? Then it comes to what is the then medial border or lip? फिर medial lip के नीचे supracondylar. फिर which tubercle? Adductors. Sit down. So write down. Vastus medialis takes a same linear origin starting from the lower end of intertrochanteric line. Then on the back on the spiral line. Then on the medial lip of linea aspera. Then on medial supracondylar line. Okay, it starts from lower end of intertrochanteric line. Then on the back on the spiral line. Then on the medial lip of linea aspera. Then comes down to the medial supracondylar line up to the adductor tubercle. Krishna Prasad Mukherjee. Bolo. This one. This is gluteus medius. A 2D image. Okay. Make a guess where is this attached. Trochanter. Greater trochanter. Okay. Then which part of greater trochanter? Upper part. How many surface does the greater trochanter have? What do you think is this surface? This is a 2D image, huh?
So posterior surface.
Lateral. Sit down. The gluteus medius is attached on the lateral surface of greater trochanter. Lateral surface of greater trochanter. Aditya R. Solanki. You are from?
Maharashtra.
You have given by one mind. Okay. What is this tubercle?
This is the greater tubercle.
No.
Can you point it again?
This one, this part. What is the thing that is joining the greater and lesser trochanter on the posterior aspect? On the posterior aspect there is something that is joining.
Trochanter's crest.
And on the intertrochanter crest there is something.
Quadratus tubercle.
Quadrate tubercle.
Quadrate tubercle.
So, according to the name only, okay? Quadratus femoris.
Quadratus tubercle.
Quadrate tubercle. Okay. Take it. Sit down. Quadratus femoris. Next one. Quadratus femoris is attached on the quadrate tubercle. Ayush Kumar. What was the fossa on the medial surface of greater trochanter? What was the fossa on the medial surface of greater trochanter? Sit down. It is not senior, okay? This is the which fossa? Trochanteric fossa. There is one muscle. See the spelling from here. Obturator externus, okay? There are two muscles, okay? I am telling you. Obturator, first, obturator externus is attached on the trochanteric fossa. Okay? Write down. Obturator externus is attached on the trochanteric fossa. And this is the trochanteric medial surface. Okay? This is the trochanteric fossa on the little posterior part. Okay? So there is a part left. This is the anterior part of the trochanteric fossa. Okay? This is the trochanteric fossa. Anterior to it, this muscle is attached. So write down. Obturator internus and gemelli are attached on the medial surface of greater trochanter anterior to trochanteric fossa.
This green line indicates the ligament. The green line indicates the ligament.
Capsule and ligaments. Obturator internus and gemelli is attached on the medial surface of greater trochanter anterior to trochanteric fossa. Keshav Chauhan. What is this part? Anatomical part? What is the part? What is this part? Yeah, anatomical part. What is the name? There is a tuberosity. There is a tuberosity. देखो देखो पिक्चर देखो देख के बोलो. Okay, sit down. Write down. Gluteus maximus is attached on gluteal tuberosity. Erythrea. This muscle, iliacus. You need to tell this in respect of lesser trochanter. This is a 2D image, you cannot tell, of course.
Posteriorly.
Okay. Yes, this is a 2D image, this is posterior. You will say this is posterior, but yeah. If it was posterior, it should have been more on this side, okay? Because if this was on the medial side, okay, this is medial, this is lateral, na? On the 2D image, they cannot show you the medial aspect, okay, medial surface. So they try to draw it on the border. Okay, sit down. Write down. Iliacus. Iliacus is attached on the medial aspect from the base of lesser trochanter. On the medial aspect from the base of lesser trochanter. Arnab. Okay. Tell me, where is the pectineus attached?
Pectineus is
This one.
attached on the posterior side, below the lesser tubercle, lesser trochanter.
Yeah, kind of. Yeah, sit down. So, write down. Pectineus is attached from the root of lesser trochanter on the posterior aspect. And it goes little bit down, okay, and goes to the upper part of linea aspera. It will go little bit down. The image is not proper here. And the pectineus is attached from the root of lesser trochanter on the posterior aspect and extends up to the upper part of linea aspera. This is the muscle, adductor longus, the blue one, this part, okay? Make a guess. Where is this attached? Anterior. Yeah, tell me about adductor.
The posterior aspect of femur, so it's starting from the
Posterior aspect can be this part also. Posterior aspect is the whole thing is posterior. So in aspect of shaft, in aspect of the border, what is this border?
posterior.
And the name of the posterior border?
Linear aspera.
So it is,
Sir, it is on the medial border of linear aspera.
okay, medial lip and lateral lip, don't confuse. Medial lip is only this muscle, okay, is this one. Vastus medialis, medial lip. Vastus lateralis, lateral lip. And everything else will be linea aspera only, no medial and lateral, okay. Sit down. So write down, adductor longus is attached on the, if you divide the whole of the linea aspera in three parts, it will be the middle 1/3, okay. So adductor longus is attached on the middle 1/3 of linea aspera. Middle 1/3 of linea aspera. Dhairya. Who is Dhairya? Okay. adductor brevis, this one, from here up till here, okay? Make a guess, where is this attached? Medial lip. Okay, again, don't confuse in the exam. Medial and lateral lip is for the vastus medialis and lateralis. Everything else is linea aspera only, okay? Sit down. Your name? There, ठीक है, बैठो. Write down. Adductor brevis is attached on the posterior aspect of shaft. Aspect of shaft between these two muscles. You need to mention two muscles: pectineus and adductor magnus. This is the adductor magnus. Okay, I am telling again. Adductor brevis is attached on the posterior aspect of shaft between pectineus and adductor magnus, and on the upper part of linea aspera. And on the upper part of linea aspera. The next muscle is adductor magnus only. And on the upper part of linea aspera. This is adductor magnus, this one. Starting from here, coming down this up to this part, okay? If it is from here up to here, okay? Make a guess, where is adductor magnus attached? In the lower part, in the middle supracondylar line. Then in the middle part, you are telling me about the supracondylar line, na? This is the supracondylar part, okay? This part is linea aspera, and this part, in aspect of gluteal tuberosity, this is medial or lateral? Medial. Sit down. Write down. Adductor magnus is attached medial to gluteal tuberosity. Adductor magnus is attached medial to gluteal tuberosity. Then on linea aspera, and then on the medial supracondylar line. Adya Shahu. Yo. Tell me. Okay. This is a muscle, biceps femoris. Okay. This one. Okay. From here to here. Make a guess. Where is this attached? And on the lower part? On the lower part? Sit down. Write down. Biceps femoris is attached on the linea aspera and on the upper part of lateral supracondylar line. Upper part of lateral supracondylar line. Okay. Ghodpade Sai Sachin. This is a muscle, plantaris. Make a guess. Where is this attached? Ghodpade Sai Sachin. Yeah, on the lower aspect. Write down. Plantaris is attached on the lower part of lateral supracondylar line. This one. Lateral supracondylar line, lower part. Harshvardhan. This is gastrocnemius. It has two heads. One is medial head, one is lateral head. Okay. This is the medial head. This is the lateral head. Make a guess. Where is this? Which part is this? This one. Medial head of supracondyle. This is the condyle. These are the condyles, okay? And the most prominent part of this is this only, okay? These are the epicondyles, okay? So if it is attached here, okay, it is in direct relation above the condyles, okay? So you say in respect of condyles. Okay, so sit down, write down. Gastrocnemius medial head is attached above the medial condyle, above the medial condyle on the popliteal surface. This is a popliteal surface, this triangular area, this lower triangle, this is the popliteal surface. You will see that on the back of the knee. This is the popliteal surface. Can I what? Repeat. Popliteal. P-O-P-L-I-T-E-A-L. This is gastrocnemius lateral head. Okay. This is the, what part is this? Epicondyle. Okay. The gastrocnemius lateral head is attached anterior to it. So you can say it is on the lateral surface of lateral condyle. Write down. Gastrocnemius lateral head is on the lateral surface of lateral condyle. Remind me about anatomical position. Huh? I'm not told. Okay? And there is one last muscle. Okay? This is popliteus. Okay? This is the lateral epicondyle. Okay? There is a groove here, if you can see. Okay? This is the lateral epicondyle. This is the groove. So this is attached here, the popliteus muscle. Okay? Write down. Popliteus is attached on the posterior, it is not there on the image, on the posterior inferior groove of lateral surface of lateral condyle. Okay. Popliteus is attached on the posterior inferior groove of lateral surface of lateral condyle. Okay, lateral surface of lateral condyle. Now about the, you will tell me? Yeah, you will tell me. Will you? Okay, that's an exception. Okay, you can tell. Of this bone. Can you show me? You can. Yeah. This is left-sided. Okay. Okay. Don't make this. I mean, that's an exception. Okay. For the anatomical position of this bone. Okay. This is femur, and on the exam, if it is left-sided, hold it like this. Okay. Bhulna mat. Don't hold it like this, or don't hold it like this. Okay. This. Okay. With index, not with the middle. Index one. Okay. And don't be, not like a scissor. Okay. Like this. If you hold it like this, so write down the points. There are 3 points for determination of the side. First point, the head. You will tell me an answer. Stand up. Can you tell me the directions of the head of humerus for anatomical position? Medially. Two more things are there. Medially. Anterior lateral. Okay, sit down. The humerus, for the humerus, the head was medially. If it was left-sided, okay, medially, upward and backward. Okay, for the humerus, not for this. For this, the head should be medially upward, on the upper end, upward and slightly forward. Okay, tell all those points. Don't just say medially on the exam. Medially, upward and slightly forward. Second point, the shaft. The axis of the shaft will direct downward, and can you see it is going medially, the lower end like this. It is not straight, okay, it is going like this, okay, if you hold it, and medially. The long axis of the shaft will direct medially and downward and medially, okay. This is the long axis. And there is another point on the original bone. You go and see, this is the, which surface is this? If this is the left sided, the anterior, the shaft, okay, it will be a little convex like this, okay, not flat like this, okay, a little convex. So the, on the second point only, and the convex part of the shaft will face anteriorly. Convex, what did I tell? Convex part of shaft will face anteriorly. Okay. Third point, if this is a same plane horizon, okay, if this is a plane horizontal line, both the condyles, okay, if I hold it like this is not touching, okay, as you can see this is, so both the condyles should be in the same horizontal line. Both the condyles should be in same horizontal plane. This is for femur, and in the exam you guys will be shown the x-rays. So the x-ray plates of every joints and every bones will be shown to you separately in a separate class, okay.